My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk And action. Hey, everyone. Tim had a question. Oh, it's Dr. Rick. Tim had a question on the fasting mimicking diet. So, fasting mimicking diet is the diet that was so popularized by Walter Longo, longevity diet. So, there's a first. We'll talk about that in a second and its benefits. But Tim had a couple questions about how to initiate and if it's worth it. So, if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So, fasting mimicking diet, FMD. Is it worth it? Yes. So, I have some before and after pictures that I've taken. I think I've taken on Facebook, but I'll try to post them at the end of this video. Oh, wait, I don't have the comparison shots, but anyway, it'd be nice if I could do comparison shots. So, I'm going to read some of the questions that Tim had. Am I a good candidate considering general health and age and etc.? Anybody's a good candidate. So, the objective is that, well, let's just put it this way. Any kind of fast is I think a good way to reset the metabolic rate. I think that most of the oldest continents or cultures in the world have had some kind of fasting, whether it's a religious fast or feast and famine fast because of weather. There's always going to be most of the older Indian, Chinese, American Indian, Inuit. There's always going to be one culture that has a Middle Eastern, one culture that has a practice, that kind of a practice as far as nutrition, withdrawing from food for a short amount of time or decreasing the food for a short amount of time. Whether it's like no food at all, just water, or just decreasing food during the day, or decreasing certain components like no meat. I think there's always a nice thing you can do as far as that kind of practice. Or the Sabbath day, like the Seventh-day Adventists. So I think it is helpful. Why? Just because as humans, I think we undulate. We go back and forth like the waves. And even if you're at the equator even has its nuances between summer and spring, summer and fall, summer and winter. And just like that, the plants will change because the plants change and the animals change because they feed on the plants. Because the animals change, we change because we feed on the animals. There's always going to be something that changes. Even our Gregorian calendar is based on ebbing and flowing. So I think it is important to reset your metabolic rate with a fast. It also, if you've ever fasted, after about the third day of withdrawing and having headaches and chest pain, shortness of breath and irritability and diarrhea and palpitations, yes, those are all symptoms of withdrawal. Usually it's from caffeine, if those of you take caffeine, or it could be from carbohydrates, or it could be from sugars. Sometimes it's just withdrawal from eating, because if your body's used to having a certain amount of calories or fuel 3 times a day and then suddenly you cut it off, it's going to retaliate. And sometimes it'll be a rough ride until you get over the hump. Then by the 3rd or 4th day, you actually will, the body will say, okay, turn off the gut and decrease the pee or decrease the poop. And now when it does that, you actually free up a lot of energy. Or what happens, especially with you keto folks, the low carbohydrate folks, you'll learn to pull out of your storage banks when in actuality, usually it's a one-way valve. You put into storage and you keep it there, lock and key, you can't withdraw. It's like a 20-year savings bond. You can't withdraw. And that's because fight or flight is always there. If fight or flight is always there, the body has to say, oh, I think we're going to go through a problem, so we better put some energy in the battery. And the only problem is you can never take it out from the battery, and you keep on putting in the battery. And when the body says, I'm going to put it in the battery, the brain says, hey, where'd that food go? I'm going to eat more food, and then put it in the battery. So you just have this huge battery. Check out the video I did on Dad bod / mommy tummy, and I think I explain a little bit of it. So, long-winded answer, I think it would be helpful for any age. I don't know that I would do it for... So it was made to be helpful for even the elderly, 70 to 80, can do it without having to worry about falling down. As far as children, I probably would be cautious. Sometimes when you give this to a grade school kid, in a very small percentage of the population, it's going to trigger an eating disorder. So you have to be careful about not necessarily the fasting mimicking diet, but more just concentrating and focusing on food. In the context of food, sometimes you get rewarded bad, and during the growing brain and the growing emotion, they might take it the wrong way if they have the gene for that. So that'd be the only thing. And I don't know if I need to fast or do a FMD for under 18 anyway. So I think it would be helpful for everybody, especially if you have cancer. I think that's why Longo put this together, was to see its effects on cancer as another alternative chemotherapy. And it wasn't as good as chemotherapy, but the outcomes for the patients that had cancer were much better when they did fasting mimicking diet, or when they did chemotherapy, or accelerated when they did both together, versus placebo and nothing alone. So I think it is helpful, even if you have cancer. So, next question. I wouldn't be doing it with the goal of losing weight. How beneficial is it for other aspects or respects, specifically regarding prostate, possibly slow-growing cancerous cells? Explain science behind it. Ooh, that's a tough one, Tim. So, in a nutshell, this will be a 3-hour a minute clinic. So when you starve something, essentially the body and all of its systems start to go into sleep or hibernation, just like your computer. And when the computer goes into hibernation, it turns off the running program, the complex running programs in the background, puts everything in memory, and then turns everything off, including the screen, until you wake it up again. But it survives on as little energy as possible just by running very, very limited background apps. Same thing happens with your body. When you initiate a trigger of starvation for 5 days, your body has a lot of things it does with cells and making new stuff and digesting stuff and detoxifying. Well, sometimes as it does that and it takes care of reproducing itself, and sometimes you can have cells that are getting a little old and they don't die. And those old cells have a higher chance for becoming cancerous. They're called senescent cells. Or you can have precancerous cells that have been normal cells, but they've been irradiated or attacked by some body of energy. And those cells are on the brink of dying, but they have learned a mechanism to stay alive. Well, when you put the body through starvation, specifically bringing down total calories per day, and Longo's fasting mimicking diet research was on a plant-based diet. For those of you who are low carbohydrate, this was based specifically on plant. I don't think he touts that because I have a feeling he doesn't want to scare away keto, but it doesn't matter. You can do this keto too. So the objective is, if you initiate that trigger of starvation, then the senescent cells and the precancerous cells die. And then your regular cells kind of go into just hibernation mode, just getting by. And when that happens, organs shrink. He was able to show that the liver and I think the kidney would shrink because the riffraff cells would die, and you have to go into hibernation. You have to decrease the energy expenditure. I believe even the brain. Don't quote me on that one. But so when the cells go through hibernation, and they are preparing to maybe die themselves, but then on the 6th day you give them fuel again, then you're giving fuel to not the precancerous cells, not the senescent cells, you're giving fuel to the new cells that just started to develop. You have these things called stem cells that start to pop up because the body says, "Ooh, I'm going into hibernation, better just make some fancy things when it comes time to make them." And that's with pluripotent stem cells. The stem cells are these cells that, think about if you've ever heard people trying to keep the placenta of a baby, cord placenta. You'll hear about people that eat that or get the placenta, that's the afterbirth, that comes out of mom after the baby's born. It's connected to the cord. It's essentially the filter in the blood flow. There are people who actually eat the placenta, and there are great stem cells in the placenta that baby got. The theory is that if you have those stem cells banked, if you ever have the need for cancer and destroying bone marrow, you can get those stem cells and put them back in and then have new bone marrow, back to normal. People who have joint problems and they have no more cartilage, if you get the stem cell from your bloodstream or your bone marrow and you centrifuge it, you clarify it, and you put it back into the joint, you might grow your lining again, the cartilage again, which is unheard of, but they're finding that they can do that. So that is when every cell that's new in your body starts to grow, and it rehabits the old areas. Then the liver starts to grow, and the kidney starts to grow, but with new cells. And so if you have the prostate that's shrinking a bit because the cancer cells are being pushed over the edge and the remaining good cells that are in there start to grow, you technically will have, I don't know if it's just going to happen in one round, but you'll technically have a new prostate, which is awesome. That is the building block. That's why, and if you wanted the, what was it? Science. Without getting too into the weeds with this, the cells in the body have a way to reproduce themselves. And sometimes when you stimulate certain pathways, like something called mTOR or PKA, sometimes those lead to cancer. So shutting those down and quieting them will not lead to cancer. So that's why it's important during the time that we do the hibernation thing, the 5-day fast. Afterward, it's really, really, really important not to binge. As I mentioned, on the 3rd day and the 4th day, I crash. And I tried to work out when I did the box. Forget it. Not supposed to work out because you stimulate the opposite reaction. You want to bring your insulin down, you want to bring mTOR down, you want to bring PKA down, you want to bring growth hormone, well, you want to play around with that, but beta-hydroxybutyrate, you want to be a little ketotic. So all those things will initiate that 5-day fast and starvation. But afterward, you want all the good cells to develop. You don't want to really stimulate the other things of protein genesis. So supposedly mTOR, if it's stimulated, can give you cancers later on down the line. But if we can refeed the body from the 6th, and I believe, I haven't been able to find it in the context of the book, 6th to the 16th day, I think that during that 10 days of refeeding, if you give those new cells what they need to be nurtured and grow, you've got a plant that will just take off. And if it takes off, you have essentially a new organ. So hopefully that, in a nutshell, and if you do it again, I believe if you do 3 in a row, that's what I kept on seeing in the book is reverberating, try 3 in a row. For normal or people who have a really good body mass index and exercise, don't have any medical problems, once every 3 months or at the least once a year would be fine. But I see no downside to this except for the 5 days. But if you can make it through 5 days, if I have only 2 days, 3rd and 4th that are tough, I can make it through that. 1st day is easy. 5th day is easy because I know the 6th day is coming. 2nd day, not bad. But 3rd and 4th day, I can make it through, and you can make it through. So anyway, hopefully that explains that. Should I continue to take daily supplements, vitamins during FMD? No. The reason we give vitamins, at least the reason I suggest my patients take vitamins is because of deficiency. I'm not going to worry about deficiency for 5 days. I mean, if I'm going to see you in a year, 5 days is not going to matter. So during the 5 days of FMD, especially because sometimes certain vitamins can stimulate pathways, stop all the vitamins for the 5 days. Unless you're, I have one patient that really depends on her supplements to keep her sane and keep homeostasis good. In that case, I'd probably say try to minimize as best as you can. But for most of us, we should stop the supplementation for the 5 days. If you go through Herxheimer reaction, I can see a magnesium coming in when you take your food. But during the time that you don't take your food, don't do that. Maybe turmeric, but I don't know how that's going to work on your mTOR and your PKA pathway. So I just say take it easy, don't take anything. How much, if any, exercise during the FMD? You can't exercise during the fasting mimicking because of what I just said. You're supposed to take it easy. I think that if you're a marathoner, you can probably back down to a little bit of walking. If you're a CrossFitter, you might be able to do a little bit of exercise. I would just say 5 days, dude. Stop. Don't do anything. And again, by the 3rd and 4th day, if you overtrain and you're underfed, you're going to hit the wall. You might not like that. And then you have a really huge Herxheimer, and you're not going to like that either. I want this to be a very nice experience for my patients. So I would just say, take a break, but on the 6th day, kick some ass. So just don't hurt yourself. And please don't dive into alcohol. I made a mistake the second time. I said, I'm going to have a beer, because I went back to beer for a short time. I'm not drinking anymore, but and I think I deserved it. I got tipsy, but it's like I just blew that 5 days that I just fasted because I just introduced beer, which is sugar. And craft beer especially, high in carbohydrates, just destroyed. I was just thinking all those little stem cells that I made, they just got destroyed by the alcohol and the sugar. So I'd say no exercise. Potential side effects and risks. If you're on medications for diabetes, might be an issue. If you take blood pressure medicines, might be an issue. I might have to curtail that because when you go into fasting, again, hibernation slows everything down, including thyroid. I haven't seen anything in Longo's book about thyroid adjustment, but I have found personally, TSH doesn't really change, but free T3 and reverse T3 do change. The body, in a nutshell, for thyroid patients, you make thyroid, after you eat iodine, it goes to the thyroid makes T4. And T4 is non-active, but it gets sent to the liver breaks it down into T3. T3 is active. But and it goes around and gives you good hair, wakefulness, no palpitations, good poop, good skin. But if the T3 is turned into reverse T3, that's inactive. And that just doesn't go anywhere. It doesn't give you any stimulation. But I found my reverse T3 increased. So when reverse T3 increases, I got no thyroid floating around. So I think that if you're on thyroid medicine, we probably should talk, those of you who are my patients. If you're on blood pressure medicine, I might have to talk, but you might have to watch your blood pressures. If you're on diabetes medicine, same thing. If we cut back on calories, if you're on metformin, it doesn't really matter. If you're on glyburide or diabeta or Victoza, insulin, you'll have to adjust to those things. So that's only a potential side effect. But the reason Longo came up with this was because of the dangers of water-only fast. So one of my contacts on Facebook, Alvin, is going through water-only fast after doing 1 meal a day. And I'm a little apprehensive because sometimes water-only fasting does yield gallstones. If you start that little snowball up with a little flake, it'll develop into a huge snowball sooner or later, meaning a big gallstone. So that's the only problem with water-only fast. This way, no reports of gallstone formation. So I really think those are the only things you have to worry about. For Tim, you don't have any of that stuff, so you should be okay. Let's see, do I need doctor's prescription or approval to undertake FMD or purchase a Prolon kit? Sorry, my patients, I tried to sign up. I did sign up for Prolon to be a representative, but I can't get the website to call me back to get service. So I'm getting a little pissed off at the internet connection I have, but I will fix it. Once I get it fixed, I'll put the Prolon page up, and then you can purchase it hopefully at cost. Or I might have to charge a little bit just to support the website, but it'll be nominal. So you can take advantage of my discount. I don't care. I'm a terrible salesman anyway. So, and I want you guys to be successful. So, and we can all commiserate together. If we do it I'm going to be doing this on Monday. So those of you who are interested, follow along or just give it a try. Don't have to buy the box. I have one box that Bonnie gave to me, but thank you, Bonnie. But the following ones are going to be just on the whole food approach. So if you can just count 1,000 calories, mostly whole food, plant-based, and if you can count 750, then you got your 5-day fasting mimicking diet right there. So there's more to it than that, obviously, but in a nutshell. No, you don't need a doctor's prescription. Just buy it. And if you can't buy it from a discounted person, you'll have to pay the full price. I think it's $250, which is a little pricey, but definitely convenient versus you calculating and bringing your food. And I had a better response when I had the box than I did when I did the food way. But I still had a response with the food. So, cost of Prolon, where to purchase? Well, I just asked that. I answered that one. Timing, how many cycles is needed to get the most benefit? 3 consecutive months. Is one time enough to make potential difference prior to December biopsy, or better to wait till 2020? No, do it now. I don't see any downsides to it. So I'd say start now. How many cycles are needed? 5 days a month, 3 months to see a change, at least in weight. As far as a biopsy, that all depends on the amount, the grade of the change in the prostate, or the aggressiveness of the prostate. There's too many variables for me to really comment on that. And also in Longo's information, I think I came across it at one point in time, but I don't know where the page was. But there was mention that he saw a response, I think it was 3 to 6 months, if I'm not mistaken, in their cancer patients. But I'm sorry, I don't remember the exact number. But if I was going to do it for a potential biopsy in December, that's kind of close. I mean, think of how long it takes to grow muscle. If you work out every day, if your sleep is great, if you're eating properly, and you're exercising like a madman, like me, then I can see it in 3 months. So to see a change in 2 months, I don't know. It also depends on how you're doing between the FMD 5-day fasts. So if you eat crappy food between the fasts, I don't know you're going to get great response. But one thing that's good with the fast is that my appetite, my craving was down after the fast. I'm not sure if that's placebo because I was looking forward to the next fast and I was trying to prepare, or if it's actually one of the effects of the FMD is that you start to have less cravings because you reset a couple different things in your body. I'm not sure. But I would say that try to do at least 3 cycles. If you're not going to be able to make 3 cycles, go ahead and start it anyway. We'll see what the biopsy shows. If there's a way of postponing the biopsy, I might want to do that. So I would do 3. I would do it every month, which I technically am doing it every month. But I don't know if I can afford the $250. I think I got that. Biopsy, wait till 2020. I'd still do it. So last question. PSA for November. Oh, no, that's not a question. Okay, so Tim, these are good questions. I think these are common questions that a lot of people would have asked me anyway. Then I have a couple more. Like I'll put the link down below for the question from Lourdes on fasting mimicking diet. So those of you who have had better benefits, or if you've found how to, when the cancer change kicks in, please put the comments down below. Otherwise, thanks for watching this far out. Good luck. Join me on Facebook, Dr. Rick Seguil, and you'll be seeing us go through the FMD as of next week, September 30th, 2019, and we'll all commiserate together because it's going to be tough, but on the other side of that, I'm going to do a DEXA scan, which will be a body fat analysis in Rockford, and compared to before I started, this would have been a fourth round of FMD. I'm going to see how my fat was back then and compared to my fat now. And I'm pretty sure I've gained muscle and lean muscle and lost fat, but I'll post it next month. So hopefully you'll see it. Thanks for watching. Don't forget to subscribe to me. Otherwise, I'll see you at the next Minute Clinic.